he was able to demonstrate that those toxins spread bacteria throughout the body and can cause a host of different diseases. Now, the dental industry itself is really only in maybe the last 10 or 15 years recognized that some particular bacteria can be directly related to cardiovascular disease. And they think that they came up with that. And it's just such a joke because Weston Price was doing this kind of research in the 1920s. We are talking people 100 years ago.
From the Weston A. Price Foundation, welcome to the Wise Traditions podcast for wise traditions in food, farming, and the healing arts. We are your source for scientific knowledge and traditional wisdom to help you achieve optimal health. And now here is our host and producer, Hilda Labrada Gore.
Hey, Hilda here. Have you had a root canal? What should you consider before doing so? And is panicking the only recourse if you've had one? This is episode 395, and our guest today is Dr. Dawn Ewing, the Executive Director of the International Academy on Biological Dentistry and Medicine. Dawn was in the movie Root Cause, and she is the author of Let the Tooth Be Known. She has a PhD in integrative medicine and lectures frequently on the tooth-body connection. Dawn explains today that while there may be some legitimate reasons for having root canals, there's also much to consider before getting one. Root canals are often performed in an attempt to alleviate tooth pain or in an effort to keep the tooth at all costs. She explains what is involved in the procedure and why root canals, along with other hidden sources of infections, could be making you sick. She goes over today why conventional dentistry misses the mark when it comes to understanding how the teeth relate to the entire body through meridians. Finally, Dawn mentions how Dr. Price himself researched the topic of root canals and how his valuable work is being recognized now with the rise of holistic and biological dentistry. Before we dive into the conversation, I want to invite you to support the work we do here at the Weston A. Price Foundation. Become a member. We are member-supported, and we rely on you to help fund our research, activism, and education initiatives, like this podcast. Help us continue sharing the message of healthy living for the land and the people by becoming a member today for just $30 a year using the code POD10. You'll receive our quarterly journal, our annual shopping guide, and a welcome package with our dietary guidelines and informational brochures. Join today, and if you're already a member, we appreciate your continued support. Go to westonaprice.org and use the code POD10 to sign up for this special discounted membership offer today. And thank you in advance. And a quick shout out to Redmond Real Salt. Redmond Real Salt is the real deal. It is mined in the US of A and 100% microplastic free. Redmond owns and operates a one-source mine in Utah that originates from an ancient seabed. Their mining practices use no explosives, no rusty machinery, or anything of the kind. And their salt has natural trace minerals, making it tasty and nutritious. Redmond adds nothing, no anti-caking agents or dextrose. It is a truly pure source of real salt. Go look at the salt that's in your pantry right now and read the label for a comparison. It just might surprise you what you find in your salt. So choose real salt today and taste and feel the difference. Go to redmond.life, that's redmond.life, and use the code WISE for 15% off your purchase. Again, that's redmond.life and the code word WISE. This is Hilda Labrada Gore, and you're listening to Wise Traditions. Welcome to Wise Traditions, Dawn.
Hello, thanks for having me.
You had a patient come and see you about 8 weeks ago who had tremors. Tell us the story.
Yes, this lady was referred from another office to me, and trying to test her tremors were really difficult for me to do testing with electrodermal screening like I do. But we did manage to get through it. And I found was an area where a tooth had been root canaled, and it was creating an electrical disturbance for her. So she went back to a biological dentist, and she and the dentist agreed that they would remove the tooth. And she had asked if I would be there the day of surgery, so I made arrangements to be there. That particular day, I was drawing blood on her, and even that was difficult because her tremors were just so strong. But what was interesting to me is the moment that the tooth really separated from the jaw itself, it wasn't even out of the oral cavity yet. Her tremors stopped. We're talking about stopped cold. And so I waited just a second, and then I tapped on her and I said, "Your tremors stopped," which made the dentist and the assistant kind of take notice. And then we all said, "Wow, that's really weird." Now, I have seen it, but I've only seen it once before, where it was in a child with a stainless steel crown that had seizures that were not controlled with prescriptions. And when the stainless steel crown was removed, that stopped the seizures. So I can't tell you, was it the metal crown on her tooth, or was it the toxins from the root canal, or the fact that the root canal is providing a dead space for electricity can't go through. What is interesting is now it's been 8 weeks, and she has seen her neurologist and her rheumatoid specialist. She's off of all prescriptions, and she still doesn't have any tremors. So I wish that kind of outcome for every one of our patients. We can never promise anything, but those types of things are what keep a biological office going, and going from the standpoint of we put in incredible number of hours in furthering our education beyond what we got and helping people who feel like there's no place for them to go and they've just been told, deal with it.
Wow. And there is such a connection between our dental health, our oral health, and our whole body's health, obviously.
Yes. All of your teeth go through different meridians, which are just electrical connections that are invisible, not imaginary. And that's really important for people to understand. Many years ago, I'd heard the expression, "I'd give my eye tooth for that." I didn't really know what it meant, even though I started off in the dental world. The eye tooth is a cuspid. It has a long, strong root, so I just thought that meant that I'd give one of my most stable teeth for that. No, that tooth is actually connected to the eye, to the gallbladder, the liver, and the eye. Who knew? Somebody knew. But it wasn't me, and it wasn't anything I was taught in school. It was stuff I was taught in postgraduate.
That's what I was going to ask you. You said many of you biological dentists spend a lot of time furthering your education. How can you get a hold of this information if it isn't taught in regular dental school?
It's going through courses. And of course, the IABDM offers courses like that, where we try to educate not just the dentist, but the staff as well. It's important that the dentist know all about it. But if the staff doesn't know, it becomes very confusing for a patient when they call in and ask questions, and the receptionist says, "I don't know, I don't do that. I don't know anything about meridians." So it's equally as important that the entire staff. So we actually certify everybody in the office if they want to, and take them through things about fluoride and mercury toxicity and meridians and the problem with root canals and cavitations, all kinds of stuff.
Wow. My hope for this podcast is that it will educate those who are unfamiliar with all of these things. So I want to back up, because sometimes the first time we hear about a root canal is when we're in our dentist chair as a patient and they're telling us, "Oh, you have an infection, you need a root canal." What is the general cause or reason given for root canals?
Of course, you named one, which would be an infection called an abscess, where the nerve inside the tooth has died. There's gangrenous tissue, and the way for it to try to get out is to go through the tip of the tooth, whether up or down, whether it's top tooth or a bottom tooth, and then that creates pressure in the jaw, which translates into discomfort. A second reason would be that decay actually gets into the nerve of the tooth. When the dentist is actually removing the decay, if it gets into the nerve, they know that if they close it up, it's going to abscess very soon. So they'll usually suggest a root canal be done then. It could be because of trauma. Now, the trauma might be that the dentist drilled too quickly, heated the tooth up. It could be that there was blunt trauma from a beer bottle hitting somebody in a front tooth to a car accident. It could be from grinding, where somebody grinds their teeth at night and it traumatizes the tooth so much that it basically dies and the nerve dies. It could be because of pain. And a lot of times what people don't understand is you can get referred pain. You could have a toothache that is not because of the tooth at all. But if you keep going back to the dentist and saying, "This tooth hurts me," the poor dentist doesn't know what to do other than to kill the tooth by doing a root canal, remove the nerve and the blood supply to try to be your friend so that your toothache goes away. But oftentimes the toothache doesn't go away because it's not the primary cause of that toothache. It's referred pain from something on that meridian that is causing the pain, or maybe even another tooth. You could have a tooth hitting on it and it's causing pain for that tooth, but it's actually another tooth that is coming up because of an infection or going down. Root canals are also done, oddly enough, where people just want a perfect smile. And a dentist will say, I can make all your teeth nice and straight, and I can do it in one visit. We're just going to grind down all your teeth. And some of these we're going to grind so small that we're going to have to do root canals, and then we're going to crown them all. But you will look gorgeous when we're done. So sometimes even healthy teeth get root canal, the name of a perfect smile.
I think some celebrities have had that done.
Yes, it's sickening.
It's so unfortunate. And literally it's sickening. This is one of the issues you and many biological dentists have with root canals, is that they are not health giving, rather they are health deteriorating.
First off, let me back up. I'm not a dentist. I started off in the dental world as a dental hygienist and then gave birth to a son that was autistic and could not figure out why, because I don't have any fillings, and ended up going back to school to work on a PhD, and then that introduced me to the world of naturopaths, so I went back to school for that. Ultimately, if you want to say finishing, because I feel like an eternal student, but I ended up with another PhD in integrative medicine, which blends the world of dentistry and medicine together to look for root causes and things, and no pun intended on that, but a lot of times it is a root or a dental issue.
Speaking of the root cause, you've given us some reasons dentists might suggest we get a root canal. I know as patients, sometimes we act on their recommendations because we don't know any better either. And we think, okay, they're recommending a root canal. Many people have had it. Why not do it? But I understand from my own research and other interviews I've done that leaving a tooth in the body that is actually dead is negatively impacting the whole body. Can you explain that a little bit, Dawn?
Yes. First, let's make sure that you understand that a tooth is a living organ. An organ has its own lymphatics, its own nerve, and its own blood supply. So think of it this way. You brush your teeth at night before you go to bed and you run your tongue over your teeth and they feel nice and slick. But what do they feel like when you wake up the next morning?
Like they've got sweaters on. Yeah.
They're slimy. Yeah. And they stink because your tooth detoxifies while you sleep. It pushes its waste through the tubules of the tooth to the outside to be discarded, just like we do when we poop. So I call it tooth poop. When you are talking about an organ, now imagine that I tell you I'm going to disconnect your heart or your liver or your kidney, and I'm just going to let it sit there. Your heart is not beating anymore, but it is there. That would not be conducive to life. Is it still alive? No, I disconnected it. There's no way. There will still be flesh in there. Now, we're taught in school that we tell a patient that we're going to remove all of the flesh in the tooth and that we're going to sterilize it, which is not possible, but that's what we're told. So we regurgitate what we're taught to the patient. So very well-meaning dentists are only saying what they were taught in school. And if they haven't gone on to further their education, then they are still misinformed and promoting bad information. Things change in medicine. We didn't know about H. pylori. There's a lot that has completely changed in dentistry and medicine.
But the root canal procedure, as it is done today, is intended to clean out this tooth that is posing a health problem also with the infections or what have you, these issues it's having. So they're trying to clean it all out, but the issue is that they're leaving it in the body.
That is part of the issue. It's twofold. There's still flesh inside the tubules, and there's no way to clean it out. No way. You can't ozonate it. You can't laser it. It's still there. So envision that you have a dead cat on your kitchen countertop, and it starts to decay, and I end up with maggots on it. I don't want chemicals on my dead cat, so I ask someone to come in and ozonate it. All the maggots fall off. But 2 weeks later, I end up with new maggots. So that's what's going to happen with the tooth is you have dead flesh. You can't interfere in God's plan. This dead flesh that's there, bacteria was put on this planet to scavenge dead flesh. That bacteria ends up in your body. That bacteria does not require a blood supply in order to move. That bacteria can end up, if I bury a soup bone in the ground, that same bacteria will find the marrow in that soup bone and clean it out. There was no blood supply in the dirt. That bacteria gets inside your tooth and it multiplies. It's in a dark, moist, warm environment. And so it starts to be prolific. And then when you bite down on that tooth, there's so much bacteria in there that it mushes out through the end of the tooth, through little microfractures in the tooth, to the rest of the body in areas where we do have a blood supply in the bone, in the jawbone itself. Now that's one issue, all of this bacteria. For me, it's an electrical disconnect. If you have a lamp that is working and while it's plugged in, and then you cut the cord and you remove an inch of the wiring, the cord could still be plugged in, but the lamp's not going to turn on. Now, if I make a phone call for an electrician and he's on his way out, but before he gets there, my dog poops on the cord right where the break is. It's not the bacteria that's in the dog poop that is the issue. It's the electrical disconnect. Your body is designed by its maker to deal with issues. Imagine picking up a phone, trying to dial 911, and you don't get a signal. You're going through the motions, but you're never going to end up with an ambulance there.
And our body, as you said, there are these meridians where there are these networks of electricity that are running from certain teeth to certain organs, and they're communicating back and forth. And if there is a disconnect, as you're describing, because a tooth, some of its flesh has been removed, the rest remaining there, it's short-circuiting the system. And what can that result in?
Not enough electricity getting to other needed areas. So we'll use the example, you could have a tooth that is causing a problem for your body, and it could be as severe as cancer. It could be as minor as constipation. Vice versa, you could have an issue that causes a problem for a tooth. For instance, I was taught years ago, if you got decay, I should shake my finger at you, tell you that you're ignorant, you don't know how to brush and floss, let me show you how. After all of the postgraduate stuff I went through, now I look at what meridian is the tooth on where you have decay. And if I start to see 2 or 3 teeth and those are the only areas you have decay, then I'm going to ask you questions like, do you poop 20 minutes after every meal? What? No, I poop twice a week. Okay, that's not good. So that could be that the organ is not allowing enough electricity to come to those very specific teeth. So the question stands, why do you have decay? We can fix the decay. But if we have not gotten to the cause of the decay, then you're just set up for new decay. And people already hate going to the dentist. They hate it.
Coming up, Dawn goes over the work of Dr. Price related to root canals, specifically how he demonstrated that the organisms inside the root canal teeth exude gases that are noxious and can lead to a host of different diseases.
You're listening to the Wise Traditions podcast from the Weston A. Price Foundation. We pause now to recognize our sponsors.
Maritime Seafood Company. Maritime Seafood Company ships sustainable, wild-caught seafood directly to your door. All of their seafood is frozen at the time of harvest, packed in eco-friendly packaging, and delivered within 1 to 2 days. Our family has tried their scallops, their crab cakes, and their shrimp, and they are amazing. I really am at a loss for words to tell you how good their seafood is. So eat well and wild, knowing that you are supporting small family fisheries that have your health, the local fisheries' health, and the overall oceanic environment in mind. So do yourself a favor and taste the difference today. Go to maritimeseafood.com, that's maritime, MARITHYME, and use the discount code WestonA for 10% off your first order. Again, maritime, MARITHYME, seafood.com. Eat wild. And a shout out to Optimal Carnivore. They currently have a grass-fed organ complex that contains 9 organs, a grass-fed liver product, and their new Brain Nourish product. Brain Nourish contains grass-fed beef brain and lion's mane mushrooms to help provide supreme focus, elevated mood, improved memory, greater clarity, and enhanced creativity. At Optimal Carnivore, they only use 100% real mushrooms, organic fruiting bodies which are rigorously tested for active compounds. And the beef brain is sourced from the highest quality regenerative farms in New Zealand. The mission over at Optimal Carnivore is to make it easy for people to consume the most nutrient-dense foods on the planet. Plus, I love that they also plant 1 tree for every product sold, which helps the environment. So go to amazon.com/optimalcarnivore and use the code Weston10 to receive 10% off all products. Again, that's amazon.com/optimalcarnivore and the code Weston10. This is Hilda Labrada Gore, and you're listening to Wise Traditions. I think there's also a disconnect, as we were saying earlier, in our understanding that the oral health is affected to the overall health of the body. And this is where Dr. Weston A. Price comes in. Are you familiar with his work, and with his work in particular related to root canals? What were his conclusions?
Oh, yes. I am very familiar with his work because we reference it often. He was able to demonstrate repeatedly, we're not talking about once, but over and over again, that the organisms that are inside these root canal teeth, with the toxins that they exude. Realize that some of the toxins that come off are thioether and mercaptan, which are gases that come off of dying tissue, which were nerve gases used in the World Wars. So if you're talking about a top tooth that has been root canaled and these gases are coming off, it's very close to brain. But he was able to demonstrate that those toxins spread bacteria throughout the body and can cause a host of different diseases. Now, the dental industry itself is really only in maybe the last 10 or 15 years recognized that some particular bacteria can be directly related to cardiovascular disease. And they think that they came up with that. And it's just such a joke, because Weston Price was doing this kind of research in the 1920s. We are talking people 100 years ago. 100 years ago.
Oh my gosh. Yes, you're right. I do believe I read about an experiment he did, and this was a different time, so the listener should keep that in mind.
Yes.
And so a man was having kidney trouble, and it was related to a particular tooth. So Dr. Price took that tooth out. The man's issues resolved, I believe. Then he put the tooth under a rabbit's skin to see what would happen, and the rabbit got kidney issues and died. And then he took that same tooth, he cleaned it up or whatever, put it under another rabbit's skin, same thing happened. The kidney was related to that tooth.
And the toxins that were in there, yes. Nowadays, we have a great test through a company called DNA Connections, where most biological offices will offer that test for patients, so that when a tooth, in particular a root canal tooth, is removed, we are able to send it off and find out what bacteria, what virus, what fungus, what parasites are living inside that tooth. Because like I said, when the patient chews, that tooth has pressure exerted on it, and that bacteria is filled inside that tooth. So some of it is just going to gush out into healthy area that has blood that can then carry it to any other area of the body. I used to have an infectious disease control doctor in Houston that every time she was going to amputate somebody's leg because of osteomyelitis in a knee, she'd send them up to me, and certainly I would find a root canal that was an issue. And so she thought she had come up with this theory on her own. I applaud the fact that she was at least looking at it. And people need to know that Dr. Price was washing this tooth with soap and water each time. It's not that we were just sticking the same grungy tooth. It was done 30 different times in the rabbit. And then years later, you have George Meinig, who comes along, who was past president of the American Endodontic Association. So he was a root canal doctor in charge of the organization of root canal doctors, who came into the research from Dr. Price and then repeated it and found out, holy moly, this is not good.
And yet, I believe you were saying earlier that conventional dentistry does not acknowledge that root canals are not good. Why is that?
We're taught in school here in the United States, we're taught, save a tooth at all costs. If a tooth comes out, another tooth will start to tip, your entire jaw and your bite will be off. And because here in the United States, we're all about cosmetics, we would have you believe that you're going to fall apart. In other countries, take out teeth that are infected and the people don't die.
But they don't look great, which is what the dentists were trying to salvage in the U.S., like our appearance over everything else.
That's the way I was trained, is save a tooth at all costs. And it was interesting to me because we didn't learn anything about blood work in school. I went to UTDB, which is University of Texas Dental Branch, and we didn't learn anything about blood work. So when I'm going to school to be a naturopath, of course, you learn about blood work. And I'm looking at going, I just don't understand. This person's neutrophils are high, their lymphocytes are low. Obviously, they have a bacterial infection, but I've ruled out a urinary infection. I've ruled out upper respiratory. I've ruled out sinus. I just, for the life of me, can't figure out where the bacterial infection is. And then in those moments where I'm quiet, which is not often, still voice said, ask them if they have any root canals. And I did, and certainly they did. And I went, oh my gosh, because I could literally timeline their labs, and the blood work looked great until a particular year. And then from then on, there was this bacterial infection. And I said, when did you get it done? Perfect match. That root canal, the tooth abscess, that's when the original, but it never did remove the bacterial infection. So oftentimes these people are living with chronic low-grade bacterial infections, and many of those where people are prone to diabetes can make their hemoglobin A1C go up. So now they don't really have diabetes, but their hemoglobin A1C is so high, that's what their doctor knows to tell them. Your hemoglobin A1C is 15. That's crazy. Okay, you're diabetic. But then you have those root canal teeth removed, clean up those infections, and their hemoglobin A1C goes to 5. No, something's not right. It's just like a woman who has gestational diabetes. She has gestational diabetes because her pancreas cannot keep up with the weight she is and what's going on with the body. The baby is delivered, she loses weight, and nobody marks on her chart, oh, by the way, she's diabetic. No, it just gets forgiven. Our body is designed to tolerate a lot, but these chronic low-grade infections are just something your body is dealing with every day.
Dawn, my concern right now is for the person listening who's, I've had a root canal. Now what?
I don't like for people to just blatantly take out teeth, because you will find a dentist who will want to take out a tooth, and most are conditioned not to, so they'll argue with you, let's send you to an endodontist and get it retreated. But if a dentist is willing to take out a tooth, then more than likely they want to put an implant in. And there are a host of issues with the implants as well. And you really need to get a functional physician or an integrative physician. A dentist is trained to do a specific job, which has to do with the teeth. So yes, they could take out a root canal tooth. But if they're just going to drop something else in, when you place a titanium implant, it's very similar to putting a fork in an electric socket and bending it around and sticking in the bottom part. It could short out that circuit in your home. In the body, it can short out the meridian. But when you place a zirconia implant in, it's like having a stalled car in one lane of traffic. When there are 8 lanes, there's still one lane blocked. It's not as big a burden, but it is a burden. And oftentimes these people have multiple teeth on the same meridian that have died because they've never addressed the root issue, and it's caused teeth to die. That then when they start putting implants in there, now they have electrical disconnects. Think of that implant as one of those little plastic things you stick in there so your kids and grandkids don't stick a penny in an outlet. It is glued in permanently because your implant doesn't come in and out. So oftentimes I have to discuss with the patient the importance of having the physician actually be the one to tell them, okay, I see that you have 8 teeth that are missing. Coincidentally, they're all on the same meridian. You have issues on this meridian. So I'm not going to allow you to have implants at all. We're going to go with a removable partial, or we're going to ask to look at bridge work until we get you healthy enough that you can give up a little bit and then have an implant placed in healthy bone. There's so many things that are involved with a good implant. Is the vitamin D level between 60 and 80? A dentist doesn't check things like that. So again, it's getting your physician involved, and it's not a traditional physician because they don't get it. They don't get this in school. It's all postgraduate stuff.
Yes. And what about the person who hasn't had a root canal yet, but whose dentist has suggested it? What alternative do they have?
Why are they suggesting it? Is there active infection that's documented that maybe you don't feel? Is it because they want to crown a tooth and put a bridge in and they really need to remove a lot of tooth structure in order to do that? Again, what are your options? You have to evaluate what the reason is that they're telling you. Sometimes, like I said earlier, it's referred pain and they just don't know what else to do. And you're complaining about something. So that's what they were trained. So it might be going to see an MD who says, oh, you have a thyroid issue, and this tooth is related to the thyroid. So if you remove this tooth, only another tooth is going to start complaining that happens to be on the same meridian. So is the tooth actually dead? If it's dead, there's no Lazarus. We have not figured out a way to rejuvenate a tooth. Dead is dead. So there are times when I actually will suggest a root canal. For instance, if a young woman is in a car accident and she breaks off a front tooth and her wedding is next Friday, it would be more traumatic for her to have a tooth missing for her wedding images rather than have a root canal done and some cosmetic work done in order to get her to a place knowing that afterwards we're going to be reevaluating and scheduling her for whatever is required.
So it sounds like it's going to take some of a, I don't want to say a bird's eye view, but stepping back and assessing your overall health before proceeding with any procedure.
Correct. I had a gentleman recently, and I was fortunate enough to lecture at the same conference that Sally Fallon was at. And I was presenting this because it was really recent and it was a really good example. This man was almost 50, he'd never had decay in his life. All of a sudden, he has a tooth that has abscessed and another tooth that has a cavity. They're on opposite sides of his mouth. One's on the top, one's on the bottom, but they are on the same meridian. And so when I finished doing testing, 6 of the 8 teeth that are on the thyroid said that the thyroid was a huge block, preventing electricity going to very specific teeth. So I said, what's going on with your thyroid? Nothing. Oh, he said, that's not true. Before COVID, probably December 2019, I don't know, my doctor tried to tell me there was something going on. I think he said there was a nodule, but I just haven't followed up with having it checked out. And so in my mind, I'm going, holy moly, probably has thyroid cancer because it had to be huge that would disconnect energy going that significantly. If you made it to 50 and you've never had decay, chances are you're going to make it through the rest of your life, short maybe having a stroke and not being able to brush and floss. So this was a really good, and I gathered all the information so that I could show very conventional people. Again, we can take out the tooth or root canal it. We can fix the other area of decay and send him away, but we are doing him a disservice if we don't get him in the hands of a physician that understands the connection. So it really takes a team approach.
Absolutely. And I think it also takes, as you alluded to earlier, seeing people that aren't in the conventional system, and especially in the conventional dentistry system, I would say, because mercury, for example, is a known toxin, but it's been used for decades to fill cavities. Fluoride is in our toothpaste and in our water, ostensibly to prevent tooth decay, but it's a neurotoxin.
It sure is.
So it could be that the conventional dental community is mistaken about root canals as well.
Again, it's what you're taught in school. I mean, you realize that going to a state-run university, I expected everything that I was being taught was the gospel. that it was just true and factual, that there was scientific backing. There's very little scientific backing on root canals. Very little research has been done on them and how they affect the body by the people who are doing the research. Sometimes there is research done that gets squashed. For instance, Boyd Haley was involved with doing some research showing the toxicity of the materials that were placed inside the tooth, only to have his company bought out by an undisclosed person for a large sum of money. So he was excited, only to have them completely destroy all of the research. Come to find out, it was the company that was dealing with the making of the materials that was going in there, because they found out that his research was not going in their favor. Yeah, it's very interesting talking to him. He's got a major chip on his shoulder about that entire process and how it went down.
So they bought it out to wipe him out, basically, to wipe out what he was finding.
Correct. So, you know, we're taught something, and if you can't go in with open eyes and say, what I know now as the truth could change. And trust me, it's going to. And sometimes very drastically. Totally 180 from what we know. Years ago, we were told eggs were bad. We were told butter was bad. Eat margarine. And look at where we are now. Eggs are good. Butter is great. It's all in where the people you hang out with. And I've also learned that when you are reading, even when it's research material, who was doing the funding? Because a lot of times the numbers get manipulated and they're hired by somebody and they're backed by a particular company. So you can twist anything and get it on PubMed.
Oh my goodness. Speaking of studies and research, we want to encourage the listener to delve into this further. You and I were talking about some resources earlier. Why don't you share them with our listener, a couple of books that they might read to open their eyes about what the possibilities are in terms of dental health?
Yes. Of course, they can go to our website, iabdm.org, and we've got lots of podcasts and things there where we try to educate both the dentists and lay people. I wrote a book, Let the Tooth Be Known.
I love that title, Let the Tooth Be Known. That is awesome.
Dr. Blanche Gruby wrote a great book, Chew on This But Don't Swallow. It's about mercury. Felix Liao wrote a great book. It's all about airway. When I started in dentistry, again, things change. We were taught take out bicuspids in an effort to push your kids' teeth back quicker and have them have a straight bite. But God thought their jaw should be so long, and we decided it should be shorter. So we've actually created an entire generation of people who have sleep apnea and snore because their tongue can't fit in their mouth. That's a great book. Then there's a brand new one that has come out recently. It's Garbage Collector. It's from a dentist out of Australia.
I've heard of that one, yeah.
That is a good book for references. Anybody who hears me and says, oh my God, that lady, she's blowing smoke up our skirt. That's just not true. Yeah. Almost everything I said as I was reading his book, I was going, oh my gosh, I know that person. Oh my gosh, I know that stuff. I participated in some of those studies. So yeah, it's a great reference book. Everybody should have it, especially a biological office should have it.
That's a great list to get us going in this topic, and I'm so thankful for this conversation. I want to pose to you now, Dawn, the question I like to pose at the end of the show. If the listener could just do one thing to improve their health, it may or may not be related to dental health. If they could just do one thing, what would you recommend that they do?
Of course, I'd love to say something like take care of your teeth.
You can say that. That's fine.
No, I actually think if there's one thing, it's breathe. We forget to breathe. We don't breathe correctly unless we take yoga classes or voice lessons. We just don't give enough credence to breathing.
Wow, a beautiful word to end on. Thank you so much for your time today. I'm so grateful.
You bet.
Our guest today was Dawn Ewing. Go to iadbm.org for more information on holistic dentistry. That's the acronym for the International Academy on Biological Dentistry and Medicine, iadbm.org. And I'm Hilda Labrador, the host and producer of this podcast for the Weston A. Price Foundation. You can find me at holistichilda.com. And for the transcript for this episode, visit our website, westonaprice.org, and click on the podcast page. And now for a recent review from Apple Podcasts. Happiest Fam had this to say: I always anticipate a new episode. I love listening to this podcast, especially the latest episode about the GAPS diet with guest Natasha Campbell McBride. It was so informative. Each episode will give so much insight and is easy to understand. Happiest Fam, thank you for your review. It really, really means a lot to us. And you too can leave us a review. Just go to Apple Podcasts, click on ratings and reviews, give us as many stars as you like, and tell the world why you enjoy the show. And thank you so much for listening, my friend. Stay well. Hasta pronto.
On behalf of the Weston A. Price Foundation, thanks for listening. We have many free resources to support you on your health journey. Visit westonaprice.org to find podcasts, articles, videos, and more. You can also find a local chapter near you for help in finding sources of great food. We invite you to support the Foundation's mission of education, research, and activism by becoming a member. Thanks again, and take care. Wise Traditions is a project of the Weston A. Price Foundation for wise traditions in food, farming, and the healing arts. The content on this podcast is provided for informational purposes only and is not intended to substitute for the advice provided by your doctor or other healthcare professional. It is not intended to be, nor does it constitute healthcare or medical advice.